this video, we are going to be discussing constipation. I am going to explain to you what constipation really is, some of the things that you can do at home if your baby is constipated, and when you should see the doctor. Your baby has not yet worked out how to relax their pelvic floor when they're having their bowels open. Babies can appear to strain, grunt, or even go red in the face. They need to stretch their legs and tighten their pelvic floor. So how can you tell if your baby is really constipated? Maybe your baby's bowel habits has changed. For example, your baby is pooing for fewer than 3 times in a week. Your baby might be feeling less hungry than usual. Baby's tummy will feel hard to touch because of bloating. Baby's tummy is hurting quite a lot. Baby's poop will be hard and painful to pass. Here is an example of the Bristol stool chart to determine if your child is constipated. Type 1 stool or type 7 may mean that your child is constipated. Now, let's look at some common causes of constipation that are easily avoided. So, what causes constipation? What makes it harder for your baby to go for a poo? Baby's diet recently? Have you changed their routine? Milk intolerance is a common cause of constipation in younger babies. For younger babies, they may have an intolerance to a new milk that you are feeding them. This simply means that baby is not tolerating this change in formula. If you have just started your baby on solids, it may be that your baby is just not getting enough fruit and fiber or vegetables in their diet. So mommies and daddies, you may be thinking, when should you be worried? So there are some medical conditions that can cause your baby to become constipated. Some conditions that we see as pediatric nurses, although they are very uncommon, will cause constipation and will need medical advice. Also, if it's a case that your baby is not tolerating the specific formula that you are using, you want to talk to your doctor if your baby is not gaining weight, your baby is having severe pain and distress when pooing, your baby is vomiting. You should be worried when constipation is making it very difficult for your baby to poo. When your baby is finding it very hard to go to the toilet, very hard to poo. If there's any blood in your baby's stool, then you should definitely see a doctor. Once you've dealt with your child's constipation, you want to prevent it from coming back again. So here are some simple things that you can do at home. Massage your baby to prevent constipation or to relieve constipation. But my advice to you is to seek professional advice before you do any massage on your baby. Make sure that you have the right technique. Feed your child a variety of foods, including lots of vegetables, fruits, and plenty of fiber in their diet. So you need to make sure that your child has plenty to drink, because dehydration can increase constipation. So drinking water or even diluted juices will get the poo to remain soft. You need to wait until baby is 4 to 6 months old before offering them water. After your baby turns 6 months old, you can start plenty to drink, especially if you live in a very hot climate. Some parents even say that they have to help their baby to poo by lifting their legs. Doing bicycle legs on your baby will help them to poop easier. Here's an old trick for you. While you are bicycling the baby's legs, you take both of baby's legs and gently push them into your baby's tummy. Also, if it's a case that your baby is not tolerating the specific formula that you are using, you can speak to a doctor who can get you some formula, prescribe a formula for you to use for your baby, for sensitive babies, for babies with sensitive tummies. So there are special formulas that you can try. Speak to your doctor. It's always helpful to remember that all babies are different. As long as your child is otherwise well and the feces are not hard or painful to pass, it's perfectly normal for your child to go 2 to 3 days without passing a poo, while other children go frequently, several times a day. So as long as your child is well and is not straining and the poo is not difficult or painful to pass, this is perfectly normal. It is very important to note that type 7 stool in the Bristol stool chart is still not normal. Your baby may be having diarrhea, loose stool, but they may still be constipated. This is something that we call overflow soiling, which is very common in older children. So look out for this. If you have tried all the tips that I have mentioned above and your child is still not going to the toilet, then you should definitely see your doctor. Doctor may recommend a baby suppository to help your baby to poo instantly. So, thank you so very much for choosing to watch this video, and if you get any value whatsoever from this video, please don't forget to give me a thumbs up, like and subscribe to my channel and help me to reach 500 subscribers